Hi everybody, good morning. Dr. DeResti with the cranial release technique. There's been a phenomenon that I've been waiting to talk about, and I've been noticing it, and I think now's the right time, which is, remember back from other videos that I've done on the cranial release technique, one of the things that we find in our analysis of evaluating the cranium of a patient, it's a very simple test by taking your two fingers and placing them in the ears of the patient, in the ear canal, and you'll probably see some distortion. One finger will be anterior or posterior, or forward or backward, or higher or lower, superior, inferior. There'll be all sorts of rotations of the ears, which is just an indicator of where the temporal bones are in space. And the temporal bones, a very important bone on each side of the skull. And when the ears are misaligned, that tells you the temporal bones are misaligned. When the temporal bones are misaligned, many times these patients will come in and complain of things like ringing in the ears, or tinnitus, as it's called, buzzing in the ears, ear issues, balance problems, things like vertigo, problems in the way of balancing, TMJ, or the temporomandibular joint, where the jaw meets the skull. That's the temporal bone where the mandible, the jawbone, connects. And there's a joint right here on either side. So as the ears shift, in your mind's eye, you can imagine the temporal bone shifting. As the temporal bones shift, that then negatively impacts on the ability of the brain to function normal. I mean, that's the whole point of the cranial release technique, which is to optimize function. So if the temporal bones are misaligned, there's no way that the brain and central nervous system can function normally. Okay, that we covered before. Now we put into the mix the mask that most people are wearing. Well, some people are still wearing. And some people, I was just in a store the other day and I saw not a single mask, but a double mask. So that mask is taking that patient with the already distorted temporal bones, the already distorted ears, and now pulling on the ears. In my mind, what that's going to do is take that distorted temporal bone and further distort it, worsen the problem. So if you're one of the people that feel you need to wear a mask all the time, I'm just wondering, have you noticed things like jaw trouble, grinding your teeth at night, balance issues, tinnitus, or the ringing in the ears, or just overall lack of vibrancy in your health? Well, to me, it's the cranium that's distorted, now being complicated daily by the wearing of the mask. And I understand some of you feel you need it. Some of you may have to wear it at work or doing what you do throughout the day. I understand. So my suggestion for the patient out there is to find a practitioner that knows how to do the cranial release technique, and you can get yourself evaluated. And again, the technique is a very simple 1 minute, you lay on the table to balance this. And many times the temporal bones and the ears become balanced in one visit. I mean, you'll see it. You'll see the change before and after. If you're a practitioner out there, you're a chiropractor, you're a dentist, you're an osteopath, a naturopath, a therapist of any sort, and you put hands on patients, you might want to look into learning the cranial release technique to help all these patients. Because I can tell you, if you just go home and look at your wife, your husband, your kids, your mom, your dad, just place your fingers in the ear canals, and I'm almost willing to bet you're not going to see this. And I don't know if it'll come out good on the camera. You'll see things like that or like that. Distortion. Distortion seems to be normal when you start to look for these things, which in fact is not normal. So, cranial release technique, that's what this is all about. A very simple way to address what we're looking at is the ears, but the actual issue is the temporal bone. And again, for the practitioners that may want to learn more about this, you can visit the website cranialrelease.com, where you can search for a practitioner, or you can click on the online training button where you can learn how to learn the cranial release technique, the 8-module program in your home or office, where I give you everything you need to know about how to learn the cranial release technique at home. Again, this is Dr. Duresti. Cranialrelease.com is the website. Thank you so much for watching this video. Please share it to friends and family. And I think on our next video, I may show you some slides explaining more about the temporal bone so you get a better understanding. Or you can just look it up on Google, the temporal bone. We have 2 temporal bones in the skull, very important. And again, the cranial bones are moving. There's this constant, slight, involuntary movement, and that distortion causes that movement to be reduced, which short circuits health anywhere in the body. Dr. Duresti, Cranial Release. Talk to you soon. Have a good day, my friends. Goodbye.